All righty, good morning, everybody. Again, we are going to be in our equipment and materials for surgical and for other procedures within the hospital. We'll kind of touch on surgical instruments today, but throughout this lecture, we'll also get into different equipment and instruments that we're going to use for like diagnostic procedures, and for large and small animals. So we do have different tools that we'll use for breed specific or just that distinction between our large and small animals. All right. And this is posted up in 105-2, and I'll show you guys where to find that after, and I'll be posting this video as well. So getting into our surgical instruments. So these instruments are going to be those tools that you see that we're using during surgery. Now, something that can be hard about memorizing these tools is they look very, very similar, and it's very minute details between the different classes of these instruments, especially the different types. Some of it is just the difference in the length of the handle or in the serrations down the jaw of the tool. So I'll get into kind of these subgroups. And within these subgroups, I'll go over specific instruments within these groups and why they're different. Now, I highly recommend that you use your little surgical instrument, that little flip book. It'll definitely help you in memorizing these instruments. So looking into our different subgroups of instruments, we're going to go into forceps, scissors, scalpel handles, as well as the needle, and also miscellaneous instruments that you're going to see just with certain and specific surgical procedures. So kind of just to give you a preview, forceps, we use these tools when we're using to pinch or per se to tweeze tissue. They actually look really similar to tweezers, looking at some of the tissue forceps. And we'll get into that a little bit later. We also have hemostatic forceps that are actually going to have a clamp on them. So a little bit some differences between the two, but they are very similar within that same subgroup. We do have certain scissors that we use for surgical procedures. We'll also get into the scalpel, the different scalpel blades, the handles, and the needles that we use. So with our scalpels, we will reuse the handles and then have our different blades. So get a little bit closer look at that. And then different miscellaneous instruments for certain surgical procedures. We have certain tools that we only use in specific surgeries. For example, I'll talk about the spay hook, which, as said in the title, used specifically for that spay procedure. So getting into our first subgroup, I want to talk about forceps. Now, we have different types of forceps. Some of them look like this right here that you're looking at, this instrument, which really it looks like tweezer. So some of them do look like this nature. Other ones do have a locking handle. So we'll get into kind of the differences there. And we've got a list of our names. So we'll go through all of these together, getting a close-up look, and I'll tell you what they're used for. So we have alligators, and this is not even a full list. These are just the most common that we use in the veterinary field. So we have alligator forceps, Alis tissue, Babcock tissue, Cryles, Kelly's, Halstead mosquito hemostats, brown Adson thumbs, and rat tooth thumbs. And the brown Adsons, they can also be known as like narrow-nosed or rounded tip. Getting into our first forcep here, we have an alligator. Now, alligator forceps, we use these mostly to remove foreign bodies. Now, we don't have to use them necessarily in surgical procedures, although we can. One of the most common times and places that I see alligator forceps being used, because we have this really lengthy jaw, when they are opening and closing, as you move this handle back and forth, it'll kind of open back and forth. The jaw will open and close like a mouth. Think of an alligator, open and closing. Now, where I've seen these commonly used is to actually extract foreign bodies from inside the ears. It happens a lot, especially if you live in areas where there's a lot of tall grass or just things for the dogs to get into if you're in the wilderness. That is where we can see things like grass seeds, and such getting stuck inside the ear and down into the canal. We can also see them start to rest on the eardrum if it's gotten down far enough. So as you can imagine, having something stuck in your ear is very, very uncomfortable. The dog will be shaking their head, just in a really poor mood, not feeling great. And it can very much so damage the eardrum if the foreign body is large enough. So what we can do is, with using our alligator forceps, we will also use an otoscope, which is the scope that we'll use to look inside of their ear. And this alligator, because it's so thin, the body of this tool, it'll actually fit through the whole of the otoscope. Think of the ear cone. It fits through that in order to retrieve whatever seed, blade of grass, whatever foreign body is inside the ear. So commonly seen for that, and you don't have to have these patients under anesthesia for it. Possible a slight sedation, but they don't have to be anesthetized to do a procedure like that. So it's really just use that little gripping motion to retrieve, again, foreign bodies. That's something that should not be there. Something does not belong in the body. It's foreign. Getting into our next, these are hemostatic, considered to be tissue forceps. And we use these tissue forceps in surgical procedures to grasp organs or slippery and really dense tissue, which organs are very slippery and dense. So as you can see with these A-list tissue forceps, we have a locking jaw. That's what this mechanism is right here. So if you click down hard enough on that handle, it'll click into this lock and it cannot come undone. It will keep that adequate pressure there. Now, if you want to unlock it, you just squeeze a little bit harder, kind of move the handles off to the side, and it unhooks fairly easily. Now, the difference between like our A-list tissue and the next one we'll talk about is our Babcock is we're looking at the jaw. We're going to look at the end of the instrument here. Now, it comes together and it has a jaw that almost look like little teeth that go on both ends of the jaw. Now, this is a tool that we can use on really hardy, really, again, thick or dense tissue. We don't want to use the A-list tissue forceps on anything that is delicate in nature or could fray easily, because these teeth can be sharp in nature, especially if you're using the locking mechanism on your tool. We don't want it to shred the tissue. We want it to effectively hold muscles or organs out of the way so that we can get to what we are needing to operate on. Now, the difference between looking at our A-list tissue forceps, another type of tissue forceps we have are these Babcocks. Now, right off the bat, you can see that the handle and the locking mechanism, this is all very similar to the A-list. Very similar if you're just looking at the handle of the tool. Now it comes down, same with the jaws on both sides being smooth, but the difference is right at the end, the Babcocks have a smooth ending here. It's not jagged like the A-list with looking like the teeth. It is smooth. So that being said, we can use our Babcock tissue forceps when we are holding delicate tissues within the body. They're not going to, disrupt these tissues or cause them to fray as easily. Definitely the preferred if we're dealing with something that is rather delicate. But they are in the same family. At a glance, they look exactly the same, but looking up close, examining the tip of the jaw, we can see that there are minute differences there. And it would be very detrimental, if we used an A-list tissue forcep on very fragile tissue and just it just frayed and fell apart. That would be a large problem. So really making sure that we know the difference between the two and what they're used for. All right, now I'm going to get into some of my hemostatic forceps. So that's going to be the next few that we're going to talk about. Now, the first one we're going to look at is cryals. So these are cryal hemostats. And hemostats, this will be used to occlude bleeding before ligation. So what happens when they are removing, let's say, for example, it's a spay procedure. They're going to be removing the uterus and the ovaries and tying off at the uterine horn. So they have to use these forceps. They do have a locking mechanism up here at the handle. They will lock them onto that specific organ that they are wanting to cut out or vessel, what have you. It will add immense pressure. You can see that there are serrations, horizontal serrations going all the way up the jaw. And this will then occlude that bleeding. It's going to stop it from bleeding. And it can actually close off the blood vessel. Sometimes you need to place sutures, but if the jaw, if it's locked long enough, sometimes the tissue will just adhere to itself. Again, we use this to stop bleeding. We can also, if the veterinarian's making cuts and nicks a vessel and it does start to bleed very heavily, instead of, using our gauze padding and just trying to apply pressure, they can take their hemostats and use them to lock in place to ligate and successfully stop the bleeding for that vessel. So again, cryos, these have serrations going all the way up the jaw, all the way up on both sides. Now, the next hemostats I want to talk about are Kelly's. Now, Kelly's, looking at a first glance, looking at them, they look extremely similar. You wouldn't really know the difference, especially if the jaw was closed, if the lock was set in place and then the jaw was closed down here. It would be really hard to tell the difference. The main way that we can tell the difference is just by looking at the serrations on the jaw. Now, with Kelly's, they're only going to have serrations going halfway up the jaw. Then it's going to go flat all the way up. Now, we use Kelly's in the same way as we use cryos. We're going to use them to help occlude the bleeding before ligation. So again, stopping the bleeding or closing off the blood vessel in order to remove an organ or to make your sutures. And really, really similar, but we have to look at those serrations. On a glance, they're going to look the same. And we'll use Kelly's if we're operating on smaller patients. The rule of thumb is to use the smallest tools possible. We don't want to be using huge tools if we don't need to. So smaller vessels, we don't need serrations going all the way up the jaw like these cryos. We can go with a Kelly instead. It's also preference. Some veterinarians will prefer Kelly's over cryos or vice versa. Now, another hemostatic forceps, these are our Halstead mosquitoes. We usually just call them mosquito forceps or mosquito hemostatic forceps. And we will use these in the exact similar way as we're using our other hemostats to help occlude the bleeding before ligation. So stopping that bleeding, closing off that blood vessel as they're making their cuts and sutures. Now, looking at the serrations on the jaw, they do go all the way up the jaw, just like the cryos. However, these mosquito hemostats, think of little bitty mosquito, they are much smaller. So even though they look similar, looking at an image between cryos and mosquitoes, looking at the jaw and just the tool in itself, it looks exactly the same. But when you hold them together, mosquitoes are significantly smaller than our cryos. Now, one thing to note with these hemostats, with all of these, so with our cryos, Kelly's, or Halstead mosquitoes, is they can either be straight like this, or they can have a slight curve. Now, that doesn't change the name. They still will be a mosquito, Kelly, or cryo. It's really preference. For example, I have a good pair of cryo hemostats that I use, and I like the curved hemostats. So they have a slight curve at the end when I'm removing sutures. That's what I'm going to use to clamp onto the suture ties, move it to the side, and then remove the suture with my suture removal scissors. And again, same tool. It can be straight or curved with all of these hemostatic forceps. It's really just preference at that point. Moving into my forceps, I have my brown Adson thumb forceps, and as well as these rat tooth thumb forceps. Now, when you're looking at thumb forceps, the reason that we call them that is because we're going to be grasping the end of these forceps just like a tweezer with your pointer and thumb, and using that to open and close the jaw. There is no locking mechanism on thumb forceps. And the doctors will use these to grasp and hold certain tissue or muscle or skin out of the way. But again, they don't lock in place. It's really just for if they're searching for a certain organ, trying to find, or just moving it out of the way. Not as commonly used. I would say that definitely the rat tooth is what you'll see more commonly in the surgical packs, just because of the anatomy of the tip at the end, how the grip is a little bit different than just our brown Adson. So again, brown Adson can also be called, they call them like narrow tipped, rounded tip, thumb forceps as well, but their actual name, they are these brown Adsons. Now, they have really fine serrations going up the jaw, but they don't have any teeth that are present at the tip. So they look really similar to our forceps with those serrations going down the jaw. They just don't have that locking mechanism. Versus our rat tooth thumb forceps, these are a little bit longer. As you can see, just going back and forth, these are way shorter, the brown Adsons, versus the rat tooth do come in a lot longer lengths. And we will use these, looking at the tip here, it looks like a tooth. It's a big tooth that fits in between here. And same thing, doctors will use them to grasp, hold tissue, muscle, or skin, but they are a little bit more abrasive because of this, tooth rather than just fine serrations, but they do a better job at holding and grasping the tissue. So what I would say needing to be, that is preferred, but doctors may also just have both of them in their surgical pack as well. Again, a lot of it is preference, especially when we're talking about these surgical instruments. Very fine, minute details and differences between them. All right, next I want to get into scissors. So we do have different types of scissors that we're going to use to cut certain material or tissue, depending on what we're using it for. And we do have a majority of different sizes. We did talk about this lightly in chapter 9 about the difference between, blunt, blunt, sharp, sharp, the length, the size. So we'll just get a little bit more in-depth look at them through this. So we'll go through, we have suture wire cutting scissors, Lister bandage scissors, Litauer suture removals, Mayo dissecting scissors, and Metzenbaum dissecting scissors. So we talked about our Mayo and Metzenbaum in chapter 9 quite a bit. These are your most common scissors that you're going to see in surgery, Mayo and Metzenbaum. Now getting into our first scissors here, we have that suture wire cutting, and they are what they sound like. We use these wire cutting scissors to cut wire sutures. Now the blades down at the jaw, you can see that they do have a slight serration on them. And these blades can actually be curved or they can be straight. And you can see there's a little indentation in the back where you can actually place the wire into and then cut. Now you might be thinking, why would we place a wire suture and remove a wire suture? Trying to think of certain procedures we would use that for. Does anybody know or have an idea why I would use a wire suture or where it would be placed? Where would I place a wire suture? Think of a metal wire. I want to see some answers in the chat, and totally just give me a guess. I want to see what you guys think. So where would I use a wire suture? What part of the body would I use a wire suture on? And I want to see quite a few responses in here, you guys. It doesn't matter if you're right or wrong. I'm just asking your opinion, and I want to see what you guys are thinking of. So again, where am I going to place a wire suture? Where would I use that? Would I use it in a part of the body that's moving, like a joint? Would I use it in soft tissue? Where do you think? I only have one answer, so I want to see a few more. So the most common place, awesome, thank you guys. Now, I also want you guys to also try to think, just because somebody else gave that answer, try to, if you agree with them, great, but also it's okay to be independent. None of these answers are correct. And it's okay. I wanted to just see what you guys were thinking. So where we're going to place these suture wires is actually going to be either in our orthopedic surgeries. So if we are placing screws and plates, sometimes we'll use wires as a supplement as well to hold certain bones in place, especially if we have trauma where the bone could have been shattered. So for reconstruction, but we're not really going to remove those wires. So when we're removing wires, specifically what I'm thinking of is jaw reconstructive surgery. So if a patient does have a broken jaw from trauma, we see this a lot where they do and can have trauma to the jaw where they have a break in their mandible. So we can actually place a wire completely around the mandible to hold it into place. The patients can actually still eat and still chew their food just fine. And we'll see a little bit of the wire exposed on the caudal aspect of the lower mandible behind the incisors. And we'll need to take the suture wire cutting. We usually leave these wires in for, it could be up to 3 months. It really depends on how fast it takes for those bones to heal back into place. And then we can take these wire cutting, cut that wire and slowly remove it out of the jaw. It's pretty incredible. If you ever work in ER or in trauma, you will see this all the time. But the most common place we're going to be placing wires and removing them is in the jaw. Or just up in the cranial region. Thinking about like soft tissue, you guys, you're not wrong with the fact that we place staples in soft tissue. So we do place certain metal sutures in soft tissue, but when I'm talking about actual like metal wire, that's wiring the jaw shut, most of the time working in oral and dentistry. So not wrong necessarily. I'm just talking more about a wire suture. All right, my next scissors that I'm going to look at here, these are Lister bandage removal scissors. Now, these scissors do not have to be sterilized in the autoclave. They can just be cleaned and disinfected. As you can imagine, when we are removing bandages, these bandages are not going to be sterile. They're going to be kept on the patient for a few days at a time. So they're going to be dirtied up anyways, as we're removing to place a new bandage. So these don't have to go through the autoclave. They don't have to be sterile, nothing like that. We use them in what we would say dirty procedures. So these bandage scissors, a big difference between these and like our Mayo dissecting scissors, they are chunky and clunky like the Mayos. But you can see they have a little butt here at the end, this little thick portion that extends out from the jaw. This is a blunt tip, and it's going to help you guide the lower jaw of the scissors up into the bandage. So you can go underneath the bandage and cut up. And this blunt tip is going to help prevent from catching on the skin and possibly cutting the skin. If there was no blunt tip here, as you're taking this lower portion of the jaw and moving it up the bandage, it could definitely pinch in the skin. The skin could collect up and you could accidentally cut the skin of your patient while you're trying to remove the bandage. So really important that we only use bandage removal scissors. When removing bandages, we don't just want to take any scissors and do it. Again, because they have this blunt tip here. Now, these are the only scissors that you're going to see with this blunt tip. So right off the bat, taking a look at these scissors, I identify that it has that chunky blunt tip at the end. Those are my bandage scissors. And you might see them looking a little bit different. I do own a pair that's really, really slim. So it's not as bulky as it is in the end. It's actually a lot more narrow. And it's just different styles of it. And it's kind of just for your comfort. But these are generally what our bandage scissors look like. Now, the next scissors I want to get into, these are the Lidauer suture removal scissors, and we just call them suture removal scissors. Now, we will remove all types of sutures with these suture removal scissors, but we do not use them on wire. As you can imagine, wire is very, very strong and tough. It is a metal suture. So these wimpy little suture removal scissors will absolutely snap if we try to use it on a wire. So we only use these with our, our other mono or multi-filament sutures. Now, with these suture removal scissors, they can be large or small. We really size them according to the patient. So I have ones that are like not even, the size of my palm versus I have ones that are a little bit larger than my whole hand and wrist. And of course, if I'm working on a horse, I'm going to use bigger bandit or suture removal scissors versus if I'm working on a small cat, I'm going to use my smaller ones. Now we can identify these right away. Again, looking at the tip of our tool here, it has a little half moon, a little crescent moon shape over here, and then the scissor coming up on top. So this is what we're going to use, this little hook here, to hook under the suture that's going through the skin to then cut that suture and be able to pull it out. And through chapter 9, I did bring out some of my surgical tools and showed you. I would use my hemostats. I like to use curved cryohemostats to lock onto the ties of the suture. I'll then move it off and add a little bit pressure to the side, kind of pull it away to then expose the one suture that's going underneath the skin and holding it all together. The problem is if you cut the knot of the suture, so where it's actually tied together, you might be leaving debris and suture material left inside the patient, which is of course not what we want to do. That can cause infection. So making sure that we're pulling it off to the side and we're cutting that single strand that's actually going through our patient. Now, they do make them curved or straight. Personally, I've only ever used straight. I don't like curved. That would be like a curve here. I do like curved hemostats. And again, that's just my preference. There are other people that will like the curved. And you will also have your preference as well. These are tools. So looking at all of these with our Lister bandage, suture wire, and Litauer suture removal scissors, these are all suture scissors that, again, they don't have to be sterile. They don't have to go through the autoclave. We do want them to be disinfected and clean. And you also can have the option of buying your own tools and keeping your own non-sterile tools on you when you're working. I know that after a few years, kind of accumulated some gifts from certain doctors, and I was gifted a lot of these tools as, Christmas or birthday gifts, and they are actually relatively affordable and cheap. Looking on sites like Amazon, they do have a lot of the surgical steel instruments like this. You could buy some suture removal scissors for around $6 to $7. Now, of course, if you want the gold plated handles and all the bells and whistles, you can get yourself to spending a lot more. But these general dirty tools, non-sterile tools, we do see a lot of assistants and technicians that just have their own. Of course, because you can keep them as sharp as you want, as clean. It's not being used by everybody, so they're going to also have a lot easier time cutting and moving them. Now, getting into our next portion of scissors, we have Mayo dissecting scissors, and we use these to cut certain body tissues as well as sutures when the doctor is suturing up the patient in surgery. Now, they do have blunt-tipped ends here. You can see they're not sharp. They're not pointed and sharp. They are round and blunt. So going into the tissue, it's not going to like puncture a muscle or puncture an organ. It does have that blunt tip, so it is protected. Now, the Mayo dissecting, in regards to comparing it to our next scissors, which is our Metzenbaum, they are way shorter and clunkier in nature. So the handles here are a lot shorter, they're a lot thicker, and same with the blade, it is a lot thicker than looking like at our Metzenbaum. And they do refer to those as shanks as well. They'll say, I like to say kind of the upper portion or the handles up here, they will refer to them as the shanks versus the lower half is the jaw. Comparing those to our Metzenbaum dissecting scissors, as you can tell just right off the bat, they look extremely different, but both of those are a necessity in surgical procedures. Now, with our Metzenbaum dissecting scissors, they are way longer and slimmer in nature. The handles are extremely long. They do not have a locking mechanism. The scissors do not. And their blades are also going to be very thin. They're not clunky and kind of bulky like our Mayo is. They're a lot thinner and smoother. And the blades here at the end tend to have a light curve in them. They do make them straight, but it is preferred using those curved. The doctors are going to use this to cut delicate tissue through fascia layer when they are doing their surgical procedure on the patient, versus our Mayo, you can use that on a lot heavier tissue and cut through muscle with them. These are way more delicate of scissors. Now I'm going to get into talking about our scalpel handle and different needle instruments that we're going to use. So looking at our sutures as well as our blades. And we know that our needle holders, they're going to be used when we're suturing the patient. And I like to call this just the locking mechanism, but they'll also refer to it as the ratchet. So again, just different terminology for these surgical instruments. And that is what's going to be near these finger rings where you're going to be holding the instrument. So you can press down, it's then going to lock into place. And that's what prevents that needle from slipping. And we'll get into a little bit more kind of showing you up close what these needle holders look like and why they do such a great job of holding that suture needle in place. So taking a preview here, looking at our scalpel blades, these are some of the most common scalpel blades used in veterinary medicine, but I don't see a 15 blade in here or our 10 blades. So kind of random ones spread throughout, but they do look fairly similar. The difference is going to be the length and the width in size. And of course, we're going to size that according to our patient. I had a lot of these images on our chapter 9 lecture PowerPoint as well. Again, the most common sizes that we use, it's not really showing on these slides. I did have that in chapter 9. We use size 11, size 15, size 10, and size 20. So these are just kind of a few other examples of some different blades. And they're going to be used for certain surgical procedures. And again, also sized accordingly to our patient. So looking at like the difference in size from like 20 to 22, the blade is exactly the same. The curvature is the same. Everything is the same. The only thing that's different is how large this blade is. So of course, you know, if you're operating on a kitten or a smaller patient versus if you're operating on a horse or livestock, you're going to size your blades accordingly. Now know that these scalpel blades are extremely sharp. They will cut you like butter, and they're intended to do that. They are supposed to be that sharp. So never take for granted these scalpel blades. They're very thin and extremely sharp, and they attach to the scalpel handle. Now, we will dispose of these blades. They are a one-time use only, and then they get disposed of. You guys, when we're looking at our blades here, before I talk about the handles, where do I dispose these blades? Where do I throw these away? How do I dispose of the blades? Where do they go? Where do I throw away my blades? I want to see some more participation in the chat. Where do I throw away these blades? Where do they go? You guys should all be answering this. Awesome. Yes, so our blades are considered to be sharps, of course, extremely sharp surgical blades. So we will be disposing of these in the sharps container. We do not throw these away in the regular trash. They have to go in sharps, or we also call it biohazard or bio waste bins. Some hospitals will have certain bins, you know, that are specifically for like biohazard waste, like blood or samples, versus their ones that are specifically for sharps. But yes, both biohazard and sharps container are the correct answer. So good job, you guys. And this is really important to know because as an assistant, cleaning up after surgery and turning the surgical suite over is a large portion of our job if you work in surgery. And of course, as you're cleaning up, we need to know how do we dispose and where do we dispose of these instruments, the ones that are one-time use only, which are going to be our scalpel blades, sutures, different needles, and of course, we know anything sharp, it's going to go in the sharps container. Now, with our scalpel blades, again, these are one-time use, and you can see that they have this big gap in the middle. Now, that is to fit onto the tip of our scalpel handle. So it'll go right in here into the tip. It actually will click and lock into place down here at the caudal end of that instrument. Now, these handles, as shown in previous with that chapter 9 lecture, they can look different. They can be shorter or bulkier in nature, or longer and thinner. It's kind of going to depend on that surgeon and what's comfortable in their hands. You know, if you have somebody that is, 6'6" and very large hands versus somebody that is 5'2" and way petite hands, you may use different scalpel handles between those two surgeons, and they're going to have their preference on what they would like to use. Now, we can attach any blade. These are universal scalpel handles. You can attach any blade to the tip of this and use it accordingly. And these scalpel handles, they're stainless surgical steel, and we will be re-autoclaving these. We use them over and over and over, just like our surgical instruments. It's only the blades that are that one-time use. Getting into our suture needles, we have our cutting needles, and kind of reviewing from last time, we know our cutting needles, they have that sharp tip to them, and they'll actually have kind of like a triangular shape that will inflict that cutting action. Now, some of them are more blunt, or they have reverse cutting. And you guys can refer to the images on the chapter 9 lecture to review on that. You can also see in your flip book, they have a lot of different kinds of sutures in there and the different types of needles. Now, the doctors are going to use these suture needles. The one over here, you can see the loop. That's the one where we actually have to string the suture through. Not as common unless you're in like livestock medicine and you're placing a really heavy duty suture along, a dairy or a beef cow that's going to go right back out into the herd. Usually we're going to use these sutures that are already attached to the needle. Now, these specifically, we're going to use sutures mainly for, they will suture up the muscle layer and the subcutaneous layer of the patient. Another suture needle here, we have the taper. And as you can see, there's no cutting edge on the tip. So looking at that last one, how it's that triangular, that's a cutting tip. You can just imagine how sharp that is. Then looking at this taper needle here, it's more of a blunt tip, and we use this more to close like soft tissue. So we don't need a heavy duty cutting suture needle when suturing closed soft tissue in our patient, but we will need it if we're suturing an organ closed or tough muscle layers and subcutaneous layers as well. Versus our taper, we're going to use this for soft tissue like vascular tissue, maybe gastrointestinal tissue. So on the intestines, large intestines, colon, stomach, even in the fascia. And again, difference in those tips there. Now, I want you to pay attention to these serrations that are going down the suture needle here. Now, they're not going to cut the patient. Their intended use is actually to help the needle holders hold grip onto the suture needles. So it kind of gives a little bit more of a tread on that needle, because when we use our needle holders, these tools right here, they have a little checkerboard pattern down on the jaw. When we clamp them shut, that is what's going to hold the suture needle. Having these serrations that go down that needle, it's going to make it so much easier for it to lock and hold into place. So you'll see a lot of suture needles that have those little bumps, little serrations. And again, its only purpose is to help with the grip for these needle holders. Now, the first needle holder that you're looking at here, this is a Mayo Hagar needle holder. We do have another type of needle holder, and I'll talk about that after. Really important, they look similar to hemostats. They have a locking mechanism here. And they do have down here on the jaw, they almost look like little alligators with the ends being shorter, but they are not clear serrations that are going down the jaw. These are actually more of a checkerboard pattern. And again, the reason for that is it's going to be used to grip onto that suture needle. as the doctor is placing that suture. So we want it to stay locked and firm into place, having good grip in there. Now, the difference between these needle holders, our Mayo Hagars, and our Olson Hagars, they sound very similar, is our Olson Hagars also include scissors. So they're a 2-in-1 tool. Olson Hagars are needle holders and pretty much Mayo scissors in one. Now, remember our Mayo scissors, those short, clunky scissors, we use those when we're cutting the suture. So as the doctor's placing the suture and doing the ties, they don't usually do a continuous suture. They'll do one at a time. So they'll suture, tie that knot, cut it off, do another one, cut it off. And while they're doing that, they can either have a Mayo Hagar needle holder and your Mayo scissors, so two tools, or they can have a 2-in-1. They can have an Olson Hagar, which is that needle holder. We can see at the tip, it still has that needle holder, checkerboard pattern, but then behind it, it also has Mayo scissors. So a 2-in-1 tool. They are significantly more expensive than our Mayo Hagars. And some doctors do prefer to have just 2 separate tools, but it is so much quicker when you can suture through and just cut and keep going with your 2-in-1, that Olson Hagar. And these are a little bit longer as well because the jaw is longer with having the added in scissors portion. All right. And actually, you guys, we're about almost 50 minutes in. So what I'd like to do is before I talk about miscellaneous tools, is I actually want for us to take a little bit of a break. We'll take just a shorter break today. Let me stop the share here. All righty, we are going to resume back where we were with our surgical instruments and materials PowerPoint. So continuing on looking at our surgical instruments, we are going to get into now some miscellaneous tools. And these are tools that are kind of don't necessarily fit into one of those subcategories like the other tools did. They will be used for certain procedures more specifically, or just as a general, they just don't fit into more of instruments, they're more of materials. So we'll go through that. Looking through our list here, I'm going to be talking about our Black Hoss towel clamps, the Snook ovariohysterectomy hook, also known as the Snook hook, which is the tool that you're actually seeing right here. You can see it's a long tool with a little hook at the end. We'll look at our staple removers, as well as previewing again on those anesthetic machines, endotracheal tubes, and surgical drapes. Now, this is our Black Hoss towel clamps. We use these when we are clamping our towels or drapes down on our patients. Again, if you want to watch a great draping video, that's going to be included in the lecture videos in 105-1. So we're going to use this instrument. It's got a locking mechanism up here, as well as, depending on the one that you're looking at here, this is a very small Black Hoss towel clamp. Usually the portion of the handle here is a lot longer in length, but we'll use it accordingly to the size of our patient. If we're operating on small dogs or cats, we might use a smaller towel clamp. This towel clamp is probably only about, the size of maybe half of my hand. So very tiny in size. Usually they are about as large as our hemostats, and they can be larger if we're, operating on large animals. So we do see that these tools have a ratchet, which again, that's just known as the locking mechanism here. And they look similar to needle holders or to our hemostats. The difference is looking down here on the jaw of the instrument, there's no real serrations or anything going down the jaw. It's all smooth. And then it comes together, both of these tips, which are actually quite sharp. They'll come together as you lock the jaw. Those tips will then touch each other and lock it into place. So again, we use this when we are putting our towel drape first on our patient and then the actual surgical drape on top. We will be using these towel clamps to clamp it into place to keep it from moving while the patient is under anesthesia and open in surgery. And that's really its only intended use. We don't use it for anything other than clamping down towels or drapes. All right, next we're looking at our snook ovariohysterectomy hook, also known as the snook hook. This will be seen in all surgical packs for the ovariohysterectomy or the spade procedure. Now, the reason that we use this tool is because the surgeon is going to make a small incision into the abdomen. I've seen a lot of students that can do this within, just an inch of a incision versus a larger incision here. So they're going to take this snook hook and they are going to kind of fish through the abdomen here. And what you're seeing it's hooking onto, this is one of the uterine horns. So they're going to use this until they can isolate and find the uterine horn. And then that can help them remove the uterus, then back using their hemostats to clamp off on the uterine horns and remove the entire, as we're looking at this term, ovariohysterectomy, ovaries, uterus, ectomy, we're taking it out. So really only seeing this tool in our SPAY packs. Next tool we're going to look at here is our staple remover. And we're going to use these to remove staples after surgery. We looked at this in our chapter 9 lecture as well. So these are just two different examples. We have ones that these are our thumb staple removers, and then our just other ones that actually have little thumb loops. So that's going to be preference. These are going to be more like, think of your tweezers kind of a hold versus having those handles to actually loop your fingers and thumbs through. But the tips here are the same. I'm going to go under that staple and then that top portion here. When we clamp down on this tool, it's going to clamp on the staple and then cause it to kind of come up like a W, and we'll be able to remove it very easily. Oh, sorry, let me just look in the chat here real quick. Yeah, so they have two uterine horns, and in humans, those are our fallopian tubes. So it's just a little bit different terminology. But yes, that is what they're talking about when they're talking about the horns, Michelle. They're referring to the uterine horns. Absolutely. All right, we're almost finished here, you guys, just a few more slides. So with our anesthetic machines shown here, we did go over that in our chapter 9 lecture. So looking at our vaporizer, we have our the bags here, our reservoir bags, depending on the size of our patient. And we'll be connecting whether we're using a rebreather or a non-rebreathing system. And we do know that these vaporizers are going to be labeled with whether we're using isoflurane or sevoflurane. And this one down here actually does have that oxygen tank that's connected. So whether it's central oxygen or we might actually have a tank that's connected to our anesthetic machine. And this anesthetic machine, you can see that it's on a rolling, kind of like a cart here. So it is mobile, we can move this around with the patient. Looking at our endotracheal tubes here, this is a beautiful display of one of the endotracheal tube racks, just a different way to organize. There's a lot of different ways. Some clinics will use like shoe organizers, like ones that hang from the closet, and you can put them in there. I've seen these nice racks like so. I've also just seen them placed in drawers, separated. And we do separate them out by the size. So tiny little one over here, size 3, probably going to be going in our infant patients. So our, our kittens or our puppies versus going all the way up to size 14. This is going to be our large dogs, looking at 100+ pounds over here. Now, we know that we use these endotracheal tubes. Think of endo going into tracheal, the trachea. So it's going to be going right into the patient's trachea, and we are going to create the airway. So that is going to give access for the oxygen and the anesthetic gas to our patient while they're under general anesthesia. And we use these in small or large animals. Of course, if we're operating on horses, we're going to have endotracheal tubes that are significantly larger. They do get quite up there in size. We could probably actually use a size 14 in a foal in one of the newborn horses. Last slide for the day. So we'll stop on this. In the next lecture, we'll get into talking about sterilization instruments. So last of our miscellaneous instruments here, we have our surgical drapes. We know that this is what we're going to use to drape over our patient to help prevent the contamination of that surgical area. And we can either do that layer of towels first, or we can double drape using those back-hoss towel clamps to clamp it into place so that it's not moving. The drape that you're seeing here, this is a reusable drape. We can wash it and reuse it. And it does have an open fenestration here. So that's the hole that's already pre-cut. So it's already fenestrated. When we use the disposable drapes, so the paper drapes versus cloth drapes, the surgeons can actually cut the size fenestration that they want, the size hole according to the size of the incision, but they are a one-time use only. They'll throw them away after. Versus these cloth ones, we can keep reusing them as long as they're still in good quality, no rips or tears or anything. Alrighty, but that being said, we are going to stop here. We're on slide 31. So when we come back, we'll continue on with that.